My research is applied research. More specifically, it surrounds evidence-based assessment and treatment for people with fluency disorders. Also very important to me is the investigation of these fluencies among people who have other disorders. I'm thinking about Down syndrome, Tourette syndrome, people with autism spectrum disorders who often have these fluencies as a comorbidity. And so the differential diagnosis between stuttering and these fluencies that might accompany other disorders is extremely important. Related to this, together with my late husband, Jean Bratton, we have established a number of self-report tests, because it has always been our thinking that it is one thing for a clinician to observe a client, but it is another thing for the person who has a disfluency to also share with the clinician the view from within, the inside view. A way to do this is by means of self-report tests. Of course, you can also interview the client will give you information. However, if you can obtain information relative to the different components that are present within a person who stutters, by means of self-report tests that are standardized, that are norms, that certainly has an additional value. And we have established a number of self-report tests for children as young as the age of 3. And the test is called the Kitty Cat, Communication Attitude Test for preschool and kindergarten children who stutter. A very simple 12-item yes-no questionnaire for these young children. And by means of this research with the Kitty Cat, we were able to show for the first time that children as young as the age of 3, children who stutter as young as the age of 3, think negatively about their speech. And that negative thinking only increases with age. So given that, this is a component that we need to pay attention to early on in therapy and not just wait until that negative thinking becomes more negative. Aside from the Kitty Cat, we also developed a series of self-report tests for school-age children and adults. Those are all embedded within the behavior assessment battery. They include 4 tests that investigate what is known in the field of stuttering as the ABCs of stuttering. A standing for the affective component, the emotional component, the anxiety that I mentioned before, the fear of speaking in particular situations, the fear of saying particular sounds or words. For instance, for a person who stutters, saying his or her own name is very challenging. So there is that anxiety component related to, as I said, situations or words. Another self-report test investigates the amount of speech disruption in particular situations. And that is then the B component, behavioral component. Another behavioral component is the investigation of the use of coping behaviors. And then the C component, the cognitive component, investigates how a person, a child, an adult who stutters, thinks about his own speech and communication. The combination of those 4 tests give us good information as to what goes on within the person who stutters. It allows us for differential diagnosis between a person who stutters versus a person who might have a fluency disorder of a different nature, for instance, a psychogenic or a neurogenic fluency disorders, meaning psychogenic dysfluency, where the dysfluency clearly has a psychological origin. Some kind of psychological trauma might have occurred in a person's life. Or a neurogenic dysfluency, where we have a clear-cut neurological origin, a neurological disorder, or the person might have had a stroke and now has become disfluent. So the BAB help us in making differential diagnostic decisions. However, an additional value of the BAB is that its items point to components that need to be addressed in therapy. For instance, we get an inventory of coping behaviors that a person uses to either avoid to stutter or to escape an occurrence of stuttering. We need to address those in therapy, and so we have that inventory. We also know to what extent the person thinks negatively about his or her speech. That needs to be addressed in therapy. And we have an inventory of the situations that a person is fearful of talking in or has problems talking in those particular situations. We need to address those in therapy as well. Related to the behavior assessment battery, what is, I think, probably the highlight of my career is the fact that I have been able to share the behavior assessment battery and the kitty cat with people in 30 different countries. So after those colleagues, students contact me, they engage in translation of the tests, and then we engage in back translation and also looking at the appropriateness of cultural appropriateness of the different items. Because it absolutely does not make any sense, as often is the case, that a test is being translated from English and used all over the world, whereas some of the items absolutely do not make any sense for a particular culture. After we have done that, then I helped my colleagues or the students abroad in designing a research plan, followed by collecting data and analyzing the data. And then, of course, the major component to share those tests with colleagues, speech-language pathologists in their country, and of course, which also benefits the person who stutters.